Okay, which of the following structures is most likely to be involved in this patient? A 45-year-old woman presents with complaints of headache, double vision, and facial pain for the past week. On examination, her right eye is slightly deviated laterally, and she is unable to move it medially or upward. Her right eyelid is droopy, and her right pupil is dilated and non-reactive to light. Additional, she has decreased sensation on her right forehead and cheek. Which of the following is most likely to be involved in this patient? Okay, so we have like an amalgamation of cranial nerve issues. So right eye slightly deviated laterally. Um, okay, unable to move it up medially or upward. Droopy eyelid. So I'm seeing like cranial nerve 4, cranial nerve 5, cranial nerves 5, 1, and 3. I'm leaning then because all these areas in the same place, like at least in the skull, like the cavernous sinus is what I'm leaning towards.
Okay.
Circle of Willis would just, I mean, yeah, decreased sensation of right forehead and cheek. That's V1 and V2. It wouldn't be seen in the circle of Willis, the internal carotid. Optic chiasm is just 2. So no, pituitary gland would be at the most 2. Yeah, I would say this. This is probably my answer. This is where all of them are, at least.
Bingo. Yeah, this is actually an anatomy question, right? I think you worked through it beautifully, right? You've noticed that, oh man, I like the word that you used, amalgam, right? So a bunch of cranial nerve issues, right? You have a little bit of trigen, you have most of the ocular things, right? Three, right? So you have all these, which, like you said, they're located in the same position, right? And usually in the cavernous sinus. Circle of Willis, right? Usually, you only have cranial nerve 3 if you have an aneurysm at the most common position. Internal carotid, right? Gives you some things, but not all of it, right? Optic chiasm, like you said, that's just the optic nerve, and pituitary gland is also just the optic nerve, right? If you
Mhm.
have a pituitary adenoma, right, which is you have
Yeah.
that what is it, bilateral hemianopsia, right? So good.